Depression is the most common health problem for college students. Over 39% of college students felt so depressed that it was difficult to function, at least once during the 2016-2017 academic school year. Over 60% of college students have felt overwhelmed by anxiety at least once in the last 12 months. Around 31% of college students have seriously considered suicide. According to the National Network of Depression Centers, depression is the leading cause of disability in Americans aged 15 to 44. Mental health issues result in a $210.5 billion loss to the economy each year.
Good morning, class. My name is Phoebe Iloanya, a third-year psych pre-med major from Prince George, Maryland, and I'll be your substitute today. So today's topic is depression.
Oh, so we're going to be talking about this pudding now?
No, not oppression, depression. So, major depressive disorder or clinical depression is a common mood disorder that causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must cause clinically significant stress or impairment and be present for at least 2 weeks.
So what though?
I'm glad you asked. With an increase in mental health issues among youth, it is imperative to find effective ways to deal with this crisis. Suicide is the second leading cause of adolescent death worldwide. The National Institute of Mental Health recommends that interventions be designed to prevent the onset of clinical depression in at-risk groups. College students are among this group. In recent years, clinicians heading university counseling centers have reported a marked increase in caseloads, with many more students seeking help for mental health issues in recent years.
Okay, wait, but what does a cell phone have to do with this?
Okay, so what does a phone have to do with this? Solutions should be cost-effective and available over a wide range for those who need it. A cell phone app is a fitting source due to the popularity of cell phones and easy access for consumers. Cell phone use has markedly changed the everyday lives of adolescents. Issues about how cell phone use relates to adolescent mental health, such as suicidal ideation and attempts, are important because of the high rate of phone usage among youth in that age. Based on this knowledge, it makes the idea of an interactive, personalized cell phone app to treat depression plausible.
But hold on, how do you really know all of this? Yeah, where's all this coming from?
So how exactly do I know all this? According to a study in 2009, depression has been found to be more prevalent in adolescents with problematic high-technology device use. The possible relationship is people are using the phones to cope and deal with their depression, but it might actually be making it worse in the long run. The key would be to intervene with an effective, multifaceted app that would reverse or stop these effects. A cross-reference of another article had findings that suggested computer-based preventative interventions may be a viable and effective means for preventing depression, anxiety, and relationship distress. In recent years, with the advancement of science, there is prospect about using clinical tools to diagnose and manage neuropsychiatric disorders. A study using neuromorphotropic MRI of patients with major depressive disorder showed reductions in the gray matter and volume of both cortical regions and subcortical structures. Due to these discoveries, it's possible to use MRIs and CT technology to determine the effectiveness of an app in treating depression. So initial scans of the patient's brain can be used and compare it with the after course.
Wait a second, how do we even know this is going to work?
Yeah, this app sounds great, but how do we know it's actually going to work?
I'm glad you asked. It ties into today's lesson about a proposed research hypothesis. So, how would this work? This will be a randomized clinical field trial using an app targeted to treat depression. So participants can be undergraduate and graduate students just like you guys, age 18 to 25. So there'll be of various educational, cultural, and economic backgrounds, but have at least completed 1 year of college. So we can recruit participants through a variety of advertising sources, like flyers, paper mail, emails. So they'll complete an initial DSM-5 depression criteria-based questionnaire so we can collect the base sample of their depression and its severity. Then an emotional response survey can be done the same day. Within the same week, we can call the participants back to take their initial CT and MRI scan.
Okay, cool. So what do we do with all the information we collect?
So the overall analysis of data will be quantitative based on number evidence. So a comparison of the pre-treatment and post-treatment questionnaire answers will be the source of the numbers. Lower scores will indicate that the progress in the treatment is the same, and higher scores mean that it was ineffective. So to analyze the MRI and the CT scans, a form of analysis called machine learning will use algorithms in order to recognize patterns in the data. So the post-treatment MRI and the CT scans can be compared to determine if regions with gray matter loss improved. Past research has indicated that patients with mood disorders show evidence of white matter pathology as well as reductions in gray matter volume. Creation of an app would be a new method that could be adopted by healthcare professionals that they can recommend to their patients. Full analysis of the data would be needed to determine the rate of effectiveness, of course. The next step would be to replicate a study similar to this one.
So what about money?
That's a valid point. Medical machinery costs a lot of money.
Also, what if people change their mind and leave the experiment?
Whoa. Those are all good possible limitations of the study. But before you get too in-depth with this topic, your next assignment will be a research proposal.